Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, also known as an ear, nose, and throat surgeon, and I'd like to talk to you today about foreign bodies of the esophagus or the food pipe. So, what kind of foreign bodies do kids get in their esophagus? Well, there's a couple different categories. There are a lot of times large food items that are poorly chewed, or coins or coin-like objects. We also will see toys or occasionally safety pins or other odd objects like bottle caps. But I would have to say coins are far and away the most common. I think probably because coins are shiny and so kids are drawn to them and kids like to put things in their mouths. A lot of times the culprits can be older siblings who are playing with a toy that has parts that are appropriately small for them but too small for their younger sibling. When a child gets recurrent food stuck in their throat, especially when it's food that should pass easily. I mean, anyone can have an incident where they have a bone in a piece of chicken that shouldn't pass and get stuck. But when they're having recurrent food impactions from normal food, we think about conditions that might make it harder to swallow, like eosinophilic esophagitis, and often we consult our GI colleagues. But when a child gets a coin stuck, a lot of time it sticks in this area just above the clavicles, right around where the sort of upper esophageal sphincter is. And in order to remove the coin or the bottle cap or whatever the object is, we do something called an esophagoscopy procedure. So when an ENT surgeon does that, what we do is with the patient asleep, we place a rigid tube that goes through the mouth and we advance that to the level in the throat of where the object is, and then we use optical graspers to grasp and remove that object along with the scope. We always go back in and check and make sure there's not any damage from where the object was sitting, and most times for something like a coin or a bottle cap, there isn't significant damage. If it's an object that has very sharp edges, then sometimes there can be some superficial abrasions or tears. If we're concerned that there's a tear through the wall of the esophagus, usually we'll do some more testing with swallowed dye solution to make sure that there is no leak before we advance the patient's diet. But in most cases of an average coin that's been there for a short time, there isn't. Things that are particularly concerning, every once in a while an object will be found that's been there for a long time. When I was a trainee, we had a penny that was found that had been stuck for about a year, and that had some significant development of granulation tissue and scarring around the coin, and so that was a more difficult removal. The coin itself was sort of crumbling on removal, and so we did do some extra testing before we advanced that patient's diet, although that patient did very well. The other thing that's very concerning is batteries. So while a child with a coin might be comfortable or might be having some trouble swallowing secretions, feeling nauseated or having trouble swallowing, a battery is a true surgical emergency. A battery can sort of melt the layers of the esophagus quite quickly, and so we try to remove that as urgently as possible. So in sum total, esophageal batteries are an emergency. Other esophageal foreign bodies are concerning and need to be removed, but not with quite the emergent nature that a battery would need to be. If you've seen your child swallow an object, then they should probably be evaluated. Other symptoms that would be concerning would be difficulty swallowing food, refusing food, inability to swallow one's own saliva, and concern that the child may have been with objects that were small enough to swallow while they were not being closely watched, or while perhaps they were with an older sibling. Thank you so much for listening. If you enjoyed these videos, please subscribe to Dr. Nicole Knows.